What does personalised prevention mean to you?
It's the evolution of the patient's right to preventive measures.
Find solutions for each person.
It needs not a reform, it needs a revolution.
Today, European healthcare is under unprecedented strain, with an ageing population, a 77% burden of chronic disease. The majority of a €1.7 trillion budget is spent on treatment. Less than 4% is spent on prevention. This includes personalised prevention, an approach that uses targeted interventions to prevent diseases before they appear, progress, or reoccur. It's tailored to an individual's genetic, environmental, and lifestyle risk factors.
About 60% of cardiovascular cases can be prevented by the right health checks. So it is actually something that the industry is advocating for quite a long time, to move from treatment to prevention, treatment and cure.
The EU-funded PROFIT project is shaping a roadmap for integrating personalised prevention into healthcare systems.
The roadmap, I think, it says to policymakers, to Ministry of Health, to citizens, to researchers, to healthcare professionals, it says you have to do this because we need to overcome this challenge. We need to fill this gap, and to do that we need to do these actions. And it sets really practical actions, and also it gives you a timeline to do that.
Its latest findings were presented at the European Parliament during the 20th European Patient Rights Day, organised by Chit Adnazativa, the Active Citizenship Network, a PROFIT partner.
When the European Charter of Patients' Rights was written in 2002, the very first right was the right to preventive measure. And today we are not simply celebrating this right, we are watching it evolve. That is why events like today matter.
Genomics and predictive tools are already helping identify hereditary cancer, such as the BRCA gene mutation, along with cardiovascular risks earlier and more accurately, enabling more targeted and potentially life-saving prevention. MEP Brando Benefei believes PROFIT can be a difference maker.
Looking at the new multi-annual financial framework that we are now negotiating, we need to be sure that the right instruments with the right resources are there to support patients, to support medical operators, to support the healthcare strategies of each of our member states.
PROFIT's roadmap argues that prevention can no longer sit in the margins of healthcare policy, but technology alone isn't enough. Without public trust, data safeguards, equitable access, and political coordination across the member states, personalised prevention won't take off.
So I think we need very courageous leaders to have our finance ministers and other kind of policymakers convinced that spending in prevention is not spending, is investing.
Is it time for a new social contract for health, from reactive to proactive? Well, personalised prevention has huge potential to improve public health outcomes and ease the strain on healthcare systems. PROFIT has the roadmap. The question is whether Europe has the will to follow it.